Once again, good morning, still Daybreak Africa. We just tuned in, reaching from our studio here in Ondo City. Of course, I'm Ezekiel or Ogar. This morning we'll be talking on digitalized medicine, innovation of technology in medicine, its impact, pros and cons. I mean, to some extent, I really believe we're really heading towards the right direction. You know, the future is here, and we are talking about technology. And you know, gone ideas where we just pick out leaves and
I think those days. But if you ask me, those days, I think they were really trying. They were really trying because now I think medicine has gone a different direction, and when you look at technology, it's really helping. But then they will just be like, look at your face, you are pregnant. No, you understand stuff.
Like when you talk about technology in medicine, we're talking about improved access to healthcare, enhanced convenience and efficiency, better patient engagement and empowerment, improved accuracy and decision making, especially accuracy and decision making. You know, just like you say, you just can't look at someone and just believe it should be malaria, it should be typhoid, you know, she's pregnant. You know, at this point, we have accurate decision making, and we'll talk about cost savings. You know, among others, especially cost savings. You know, instead of course, you see people now actually treating malaria and typhoid, whereas they are actually dealing with hepatitis or maybe one form of lung disease or the other. And of course, with us in the house, the justice today's topic is a nurse in the house, President of Salawu, Adetola, Priscilla. Welcome on Daybreak Africa.
Thank you very much.
A very good morning to you.
Good morning.
How are you doing today?
I'm good, thank you.
All right, now we'll be diving straight to the topic, but I am a believer of before you go to the future or the present, there was always the past.
Truly.
So now, before the invention of technology into medical line, how was it, the involvement, how did it start from?
Yeah, just like you both discussed earlier, then it is more of trial and error. Like, let's give this a try. If it works, fine. If it's not working, we do something else. And it's the time spent, the costs, the effect on the individual. Like something you could have done and within a couple of minutes the patient is fine, and you have to start doing trial and error, and on the long run most people end up losing their lives. But with the advent of technology, it is cost effective, it is time saving and life saving.
But don't you agree with me then, like, okay, we understand with the use of technology right now, you can possibly equally just pinpoint what is wrong with someone at just a fingertip, like, okay, this is what is wrong with you, with the likes of scan and the rest. But then, we used to, I'm a kind of person that I'm very curious when it comes to delivery. Now, I said I'm very curious when it comes to situation like, okay, back in the days before the invention of technology, the social media things, there were this kind of, you said trial and error, but you will also believe, want to agree with me that there have been a lot of tremendous things they have been doing then, especially when it comes to childbirth, diagnosis of pregnancy. Because now, if you look at people like, I'm sick of an ailment, I'll go to the hospital, you will try to say, okay, this is what is wrong with you. But then, without the technology, they were able to put a lot of strings together, and there were a lot of tremendous, let me say, success in their treatment ways. Now, coming to the technology phase, there are still some things that they can't be treated. And a lot of people will be like, okay, let's go ABBA. When you go ABBA, you still get treatment. What is your take on that?
Thank you very much. Just like you said, the trial and error part, of course, a few are effective and we could get a positive result. But other time, we have several cases of a negative aspect of it and several people losing their lives. But the unfortunate thing is we don't have accurate data of what happened then, so we can't really tell the total amount of pregnant women that died with pregnancy and the likes. But now we have the data, and that's one of the importance of technology. Yes, but talking about drug is not effective and the likes, I personally do not believe in it, and medicine will tell you they do not believe in it. Yeah, because sooner or later, most times they still have to just come back to the hospital. Okay. And most of these things, it happened then because they could not have an accurate diagnosis and they have no idea of what it is. So they just believe, since we don't know what it is, then it must have been something beyond unimaginable, and we have to just start using other things. But most time they end up losing the individual. But now, when you see patients that suddenly have swollen legs and the like, the riverine area, people will say it's one of their gods that is afflicting the individual. When you get to the hospital, through several diagnostic investigations that we have now, they're able to get an accurate diagnosis and treatment is commenced. Although there are several conditions that have no permanent treatment, like malaria, We have some like the chronic kidney diseases that there's no accurate treatment yet. You only have conservative management, and sometimes if the patient is able to afford a transplant, that is possible. But all these are possible, and we're able to have an accurate diagnosis, and we can even have an idea of what transplant is because of the advent of technology.
Now, when we talk about things as this, now we talk about our level of investments, level of adoption. Now, when it comes to Nigeria as a country, just how much do you think we have invested and our adoption method? Yeah, as a country and also as a continent, have we been really investing more into technology innovation in the medicine? And
Oh, I really can't say. Because one thing is, when an individual comes up with the idea of, okay, let's do this, are the people at the grassroots, like the professionals that actually want to make use of the technology, are they willing to accept it? Are they willing to change? You know, in the health sector, before now we have a lot of pen and paper writing, but now technology has gone far beyond that. We have data, you input the data on the system and anybody can access it anywhere in the world, unlike the pen and paper that you barely have access to. But we kind of are reluctant to accept change in some way in Nigeria. So when this thing comes, we use it temporarily, and on the long run, it's off. Begin to go back to where we used to be. Then another major problem we have is sustainability. We don't have the ability to sustain certain projects. When an individual comes around and gives us good innovations, good projects, and supplies ICT materials, please make use of those things. And of course, they start using it. On the long run, when that individual leaves, somebody else comes. This new person wants to have, okay, let me do something new, instead of sustaining what we have on ground. And you see several hospitals with systems, laptop, and everything is just lying fallow. Nobody is using it.
You made mention of a very vital point where you made mention of sustainability. That is the level of continuity in a project. Yeah. It has been a problem. Now, I want to believe that most people, when you say this is a problem like this, they will say the governments. Well, I'm very sure the governments are not the one running the business alone. We also have the individuals on the company. We also have a lot of people doing it. Now, on your own part, that you have been in the field, being a nurse, you are in the field, and of course, you are in the modern age where system and the rest are being used. What do you think is the problem that has been hindering technology usage in Nigeria outside the one that you've mentioned earlier?
Okay, the most important thing is individually. We are the one we are going to be the one using this technology. The government, most time the government do their part in supplying it, although they are not doing enough. But that's not even the problem now. The little they are doing, how well are we utilizing it? And how effective has it been? Sometimes it gets effective for a while and it goes off. There was a program a few years back. It is called performance-based financing, PBF. It was a World Bank project that was introduced into Nigeria. They'll tell you, okay, when you do this, when you attend to as in like if you have about 20 patients in those months, and you're able to follow up effectively from pregnancy till delivery, we'll give you so amount of money for each patient. That kind of geared up health workers began to source for patients, they'll follow up on patients until delivery, because they know that something is backing this up. But since the project went off, I'm sure all the efforts that were put into place then that made the mortality rate reduced would have been stopped. Because, you know, we have a way of doing things when we know we have something to get in return. When there is nothing to get in return, they just do it like it doesn't belong to me.
That brings to my very next question. You made mention of something very interesting. Was it World Bank was doing that served like a motivation factor, like okay, I'm going to get something in return. But I want to believe that if you're going into lines of health, especially health, the passion of saving life should be number one on your agenda. Am I right?
Yeah, sure.
Now, if you have to wait for someone to motivate you financially, of course, I understand the fact that whatever you are doing, you are supposed to put something on your table. You are supposed to feed. You have to maintain yourself mentally and every other aspect. But when you have to wait for a motivational factor to bring you to your work, now, this brings a very big question to our health sector, especially embracing technology. We have a lot of things. You said the government is supplying, maybe they are not doing enough in your word. But also, the kind of personnel that we have, do we even have skilled personnel to utilize this technology? Because now, if you look at it, most of our dignitaries, in Nigeria, when they want to go for their checkup, they don't even stay in Nigeria. They travel out. Is it that our health sector doesn't have the ability or the people that are supposed to do these things right?
Yeah, thank you very much. You see, the health sector, there are several factors that are actually affecting it. One, you have a lot of brain drain, in the sense that most of our effective hands are beginning to travel abroad and live for greener pasture. That's because they are not encouraged here. Even when you have the passion to work, you don't have the necessary equipment available to work, you don't have the materials to work, it's kind of, it could be frustrating. Now, for example, you work in an emergency unit, you have a series of probably RTAs, as road traffic accident victims, brought into the unit, and your hands are tight. You want to work, you want to help, but you really cannot do anything because materials available, materials needed are not available. You need to, you need to write out a prescription, give to relative, please go and get this. Whereas it is supposed to be an emergency. So you want to go to places where you know my knowledge can be put into action. We have the necessary, we have the personnel, they have the knowledge, they know what to do, but the how to do it or the materials to work with can be a major problem.
Now, in places like Germany, the government tends to promote digitization in education and other sectors of the government, other sectors generally. I tend to wonder how far or how much has our legislation in Nigeria tend to promote innovations and its adoption so far, especially in the health sector?
I really can't say much about that. But then, let me talk about Ondo State.
Okay.
Yeah, the last government, the governor was a medical doctor and invested so much to the health sector, which was then he had a University of Teaching Science hospital, and it was like one of the best in the country then. But just like I mentioned, sustainability. All the big machines he brought then, the technology that was invented, and several things that were brought, they're no longer in place. And the best personnel then are no longer around. Most of them want to just travel out, go for greener pastures, and all this boils back to, you see, sometimes it could be frustrating when you really want to work, but then your hands are tight. The available resources, the resources do not meet up with what you need. You get. Then there are times that you have a patient with emergency, you need to carry out some investigations, you have to refer as far as like 2 states away for an investigation. Whereas you should have everything on ground to just work, The earlier you're able to diagnose a condition, the earlier you begin treatment, and the better the prognosis for that patient.
Okay. Now, talking about technology, there's now we are going to talk about technology without mentioning the social media. Yeah. Of course, let me use the word, I have symptoms, I have headache, I have this. At your fingertips, you can grab your phone or any of your device and just type symptoms of this. And at the end of the day, Google, a very friendly app, we say this, and a lot of things will come out. Sure. And most people will be like, okay, I think this one is my own. At the end of the day, they do self-medication. This is also, most people will feel like, okay, this is helpful, but I see it as a disadvantage. Now, on the health basis, on a scale of 1 to 10, how do you see this kind of situation affecting the health of general public?
Okay, negatively, I would say.
Both sides. Okay,
negatively, I'll say 8. I'll give it an 8. Positively, it's not really bad. Okay, let me say a 6 for the positive
I want you to
aspect.
defend your points.
Okay, we're talking about negative aspects, just like you explained. You see, we tend to just Google our symptoms, and it still boils back to trial and error. Now, for the fact that a woman is not menstruating, does not mean she's pregnant. So, okay, I missed my period, just put it on Google. The first thing Google will give you is, you're pregnant. Yes, and if you tell anybody, that's the first thing that will come to their mind. Whereas, coming to the hospital, several diagnostic investigations will be carried out, and we know exactly what is wrong, if it is pregnancy or not. Okay, so that's why I said it could be, and you see, when you have several signs and symptoms, okay, this common headache is so common. You type it on Google, Google will give you several answers. But there are times that all you need is rest for headache. But then, Google might even begin to give you suggestions of drugs to take, and you just go over the counter and get those medications. And one problem with all this over the counter medication is, it has a way of affecting us. I always say that every medication, every drug is a potential poison. So if it's not used as directed and as prescribed, then you're doing yourself more harm than good. But I think it is better, of course, technology gives us access to information. That's why if you have the information, it gives you better knowledge. So when you're talking to your doctor, you can say, okay, I have this, I have this. What do you think about it? Okay, I went on Google and I discovered that Google told me this. Is that true? What's your take about it? And okay, no, that's not right. This is what it is. Okay, to actually prove this further, go for this investigation, do this other one, then we can bring everything together and come to an accurate diagnosis. Unlike the Google try and error, and we just want to, some people that does not even have in-depth knowledge, they want to say they have an idea of what is going on.
Let's talk about inequalities in access, especially for low-income earners. Don't you think they will be on the disadvantage in all these technology innovations and stuff?
Yeah, actually, there's telemedicine, which is quite cost-effective, in the sense that you could you can even access consultants outside Nigeria via the telemedicine, via a video call. It saves you the cost of having to go down to the hospital every time. It saves you time of having a long queue on the line while waiting for the doctor. But then the cost, yeah, it's kind of cost effective. But all you need is access and knowledge about this technology too. I was going to work with an organization sometimes back, although I didn't eventually work with them. They have a kind of a remote care. The consultant is in the UK, and they have clients all over Nigeria. So they only need a representative. That's why I was contacted then. So I'll be like their eyes here. The doctor over there would assess the patient. Of course, I'm here, give my own assessment, give a feedback. You prescribe medications, give suggestions on the diagnostic medication to carry out. The results to be sent, analyzed, and sent back. Nigeria is in the UK. So now imagine having the patient live here, travel down to the UK to see the doctor. So you can compare the costs of what that would be. But technology has also brought a kind of a cost-effective healthcare, because you have access to medicine all around. You necessarily do not have to visit the hospital. Then with the advent of COVID-19, actually opened our eyes to health, so technology in healthcare, because then people were restricted from coming to the hospital. So we had other ways of accessing healthcare. We have a lot of innovations like some wristbands. Okay, yeah, we have a lot of wrist watches, smart watches rather, that have a way of assessing your blood pressure, your heart rate, and when you begin to see any deviation from normal, you can always contact your health provider. And just at the comfort of your home, you don't need to go to the hospital for that. To assess yourself, like before, if you don't get to the hospital, you can't get your blood pressure done. But right in the comfort of your home, we have a lot of portable machines that you could use. These are all due to technology, and that's really helped healthcare. So you have access to healthcare anywhere you are. You don't have to walk miles or travel miles to the hospital.
Now, you made mention of a lot of things. I must say, most of the things you've made mention of the strength of, let's say, the technology in health sector. Now, I'm very sure there are a lot of limitations that are not just hindering Nigerians alone. I want to believe that we still have illiterates among us, people that in the rural area, especially very rural areas, that they don't really understand. Of course, you still need technology to treat most of them.
Yeah.
That is there. And we also have limitations in the aspect of, let's say, I don't know what the World Health Organization, what they are really doing. But now, on your own part as a nurse, what do you think the World Health Organization can do to improve these limitations so that they can bring this enjoyment of the thing when it comes to technology in health to everybody? Everybody can access it, everybody can use it. And also, what does Nigeria government needs to do?
Okay, thank you very much. Actually, the WHO, they're actually trying their best, trying to ensure that healthcare gets to the grassroots, like to the grassroots, to the rural areas, and they encourage the introduction of building of healthcare facilities. But another problem we have is there are some health facilities that you get to, the building is just there. There are no health workers. Now, considering the remoteness of the area, most people are not comfortable living there. Okay, I read the news recently, was it in Osun State or so? Like, I think they lost a pregnant woman, and during the investigation, they discovered that there were no health workers there. I think they met the health assistants and the likes there, and they actually took the delivery and had complications and had to refer. Now, they need to have a way of encouraging health workers to go there. Not just encouraging, yeah, it's encouraging, but then you need to make the place conducive enough for the health workers to stay, because no, they have to, for them to have kind of a 24-hour service there, it has to be comfortable for them, light, water supply. I can't imagine having to put torchlight on my head and taking delivery. No, it's not comfortable and not convenient, and that is the truth. That is what most people go through, especially in those rural areas. They have no access to light, no access to water. Technology, it's a no, because there's no network there, so there's no way you can even access the internet facilities or anything. So there's a way of our government improving all these healthcare facilities. I understand the buildings are there, but beyond the building, the comforts, the technology should be put in place.
Now, you made mention of technology, and I also made mention of something, but as you said earlier, the motivation, what is it called? What is the motivational factor? We agree with me that we have this problem right now. Most of our health workers are in the mood of jackpot. They are moving out of the country for greener pastures. Do you think what is really hindering them is just for the financial aspect alone? Because there's one thing to provide the machines, the engine, the network and everything. But people that are readily available, do we have them? Because most of the institutions might not have most of the the machines that are just, okay, for example, now a machine just came out yesterday and somebody graduated some 3, 4, 5 years ago. You have to agree with me that that person might not really know how to handle that machine.
Yep.
So now these are big problems that at the end of the day, some doctors that have graduated, let's say for the past 15, 20 years ago, might have issues of operating the modern machines. What do you have to say about that?
That's a place of continuing education. Yeah, there's a place of training and continuing education. In medicine, you don't stop reading. You continue reading, you continue studying, because there are new inventions daily. And thank God for technology, you get to know about them almost immediately. Unlike before, when you have to wait till you have access to journals and the research work before you know. But now, when WHO is releasing their journal, you have easy access to it, so you can see, okay, this is the new trend, this is the new mode of treatment, because a few treatment regimen changes sometimes. So with access to technology, you're able to train yourself. It's actually a thing of the mind. Personal development also has a role to play. You need to be conscious of developing yourself, getting familiar with the new trend. Then the hospital and the government should also have a way of training the personnel. Of course, new things are coming up. There's a way they should give them a new training. Like recently in my workplace, we had a new set of machines. We are used to the old one, and we are supplied with new ones. We had about 3 days workshop and training, just to get ourselves used to the new machine. And for the first, after that, we were working under supervision until we were able to have a grasp of it. So that's how it should be. When there are new inventions, training, nobody's an island of knowledge. You need to be trained and trained over and over.
With the level of brain drain occurring in our countries, I tend to wonder what the future holds for the health sector in Nigeria. Are we at some point going to overcome this issue, or is there doom just lying before or ahead of us?
I can't really say there's doom lying ahead of us, because we still have people are graduating daily.
But they are not planning to stay. I'm very sure if I should put a question to you,
everybody will leave.
If I put a question to you, if you get an opportunity to travel out of Nigeria to practice,
yes,
of course you will embrace it.
Yes, I will.
So if the pasture is green here and everything is fine, would you want to? So I would like to say what Ezekiel said. There's like a doom, because if the health workers are just graduating from here and looking for an opportunity to leave.
Okay, the thing is, if most people that leave, they are really not comfortable there. Considering the workload, you pay a lot of taxes. I have friends that are there. Considering the workload, the taxes that you pay and everything. If Nigeria pays more, and you have access to the required equipment, more people will stay. No, seriously, more people will stay. And although recently we've lost most of our good hands, yeah, I'll say that we have lost a lot of good hands, but the people that are still available can still be trained. So it boils back to training and employing more hands. Because unlike there, when you can be the only one in a 15-20 bedded ward, There, you know, of course, you cannot be the only one. You have more hands. So if the government is employs more hands, you have more people on ground, and the materials needed are available. The motivation is there. In terms of the payment, is there. Then adequate supervision is also important. When you are being supervised, you tend to work more and better. Then patients should have a kind of a feedback. You have a way of giving feedback back to the organization. Okay, when I was around, the nurses were harsh. I wasn't too fine with this. Okay, this particular nurse was so wonderful, and she was probably not just compensated, she was probably praised. Just giving appraisal. Okay, you did well, your patients are complimenting you, and it's fine. As a way of motivating one to do more. Unlike where God is actually, Nigeria will get better.
You made mention of something, and I like it. I would like to bring it back. If I listened very well, you said when you were saying outside, that is outside Nigeria, you backed up your statement with certainty of they have. But when you came back to Nigeria, the words were with if. That means there's no certainty. Because now I want to believe that you also understand that mostly if the conditions here were favorable, of course, the doctors will go out.
Yeah, sure.
That brings back to what Ezekiel said. Doom is lying ahead, because if we are still on the word if, when it comes to health, which is a very paramount thing when it comes to the life of people, when we are still on if, because now we are getting a lot of medical doctors graduating year on year, but the truth there is, most of them, I've had conversation with most of them, and they feel like, okay, I'm qualified, I'm good with this, but if I should get an opportunity, I will leave. Now, we are still on if. Now, on this note, doesn't mean that it's just like a time bomb thinking to explode for Nigeria health sector at this point.
I believe that Nigeria will get better.
Of course, we all do.
With good government and good adequate management, then when we have good leaders that are willing to sustain what we have on ground, are willing to embrace positive changes, it has a way of boiling back to the subordinates, and you see everybody able to catch that vision and do the right thing. Then the place of supervision is also very important, because most time when you are not supervised, you tend to do whatever you like. But then the place of adequate supervision also very important. Then, like I mentioned, patient feedback. When you know somebody is constantly watching you, just like in the advanced country, I keep referring back to them. There's a quality control. You just cannot do what pleases you. At work, you cannot just use your device. When you're at work, you're focused on like what we have here. You understand? So because they know that there's CCTV camera everywhere, somebody is watching you, so you have to just do the right thing. You don't have a choice but to do the right. Even if you don't want to do the right thing, you just have to. So if we all have that same culture here of doing the right thing always, and there are enough hands. No matter how good you are, you want to do the right thing. At some point, you get overwhelmed. When you have enough hands, enough support, the psychologist is there to support you as an individual. The team is there to support you. You're not working alone. You're supposed to work as a team. You have the doctor on ground to assess your patient. The physiotherapist is there. The nurses are there. Everybody is doing their part. Then we'll have a better healthcare system in Nigeria.
Now, on a scale of 1 to 10, where if you have to rate Nigeria health sector as related to the usage of technology, what are you going to rate? And I want to know why you are giving that score.
Okay, I'll give it 3.
Wow.
Okay.
Like I said, actually, a few institutions are actually making use of technology, and we are trying to imbibe it into our culture, like into the system, but then we still have a long way to go. Okay, now, for example, assessing patients' data. Technology has gone far beyond still using pen and paper. Anybody can come, tear it off. Even the storage. When you want to access data of like 2 years back, you can hardly get it. When patient comes back after 2 years, they look for the case file, they can't find it. But then if we have a compiled data on the internet, like on the system, All you need to do is just type it out. This is the patient. You can just type out the patient's name or the file number, and you can access all of the information. Now, when the patient is living in Ondo State and going to Lagos State to see another doctor, you don't need to start all over. But here, the patient will get back there. All the investigation that has been carried out will start from square one, like begin again. But if we are able to embrace technology, you can always put a call through to the hospital the patient is coming from. Okay, we have so and so patient with us. We have your patient X with us. He presented this morning, probably as a result of emergency. We like to have his healthcare record. And okay, just with the punching of computer, with the keyboards, the information is sent. So when they have on a baseline data, like we have the previous information for this patient healthcare, and to actually help them to know the next step to take, they can assess the patient allergies. They can know the kind of medications that this patient is not supposed to take. Like a patient with a peptic ulcer and probably has an emergency, probably has pain or something, and you are giving NSAID medication like diclofenac and the like, patient should not take it. But how do I know if I don't have a prior knowledge of what the patient has? You understand? Because I'm trying to help that patient at that moment based on the information at hand. But accurate use of technology will make us assess his previous history. So I don't know, that particular aspect is we still have a long way to go. Yeah, we still have a long way to go in doing that. And it still goes back to us, like we individuals.
Just before we go off, what's your take on the privacy and security concerns? Because in all honesty, digitalization is not all that secured. You know, you could have unauthorized access to one's information and then misuse it at some point. Is there any concern?
That's one of the cons, like the disadvantages of technology. Would have cybersecurity issues, and patient information are supposed to be confidential. They are strictly even with the paper case notes, it is written on it confidential. If you don't have anything to do with the patient's health care, you're not supposed to have access to it. So I don't know, this kind of information are supposed to be well encrypted. Let me use that term. I'm not a technologist, but I know, well encrypted, and should only be supplied only to people that are involved in the patient health care. That's what I was talking about. An hospital to the receiving hospital. Okay, this patient is with us. We need to continue the management, and we need the medical history with the consent of the patient. So that consent is very, very important.
All right. I must say it has been a very educating and enjoyable moment with you in this studio.
Thank you.
Thank you for coming on the program.
My pleasure.
All right, viewers, I'm very sure you've learned one or two things. Of course, I really did learn a lot here. And I also saw how technology has been helpful from the journey so far, from the inception, from the dark ages down to this moment. Of course, there were ups and downs, but we believe with ups and downs, whatever it is, we have more positive side than the negative. And I'm very sure we'll hold on to the negative, the positive. And the negative will become our own strength that we can develop and make use of better ways to make sure they work well for us. From us here, we'll be handing over to our Lagos studio, which we believe they have more interesting package for you. I remain Micheal Obagiri.
Do have a wonderful day. I remain Ezekiel. Okay.